Here is your stem. There, once you've read this, you could see it's 2 by 5. So there are 2 more slides. Yes, next.
Yes, ma'am. Yes, ma'am. Yes, ma'am.
Yes, next.
Yes, ma'am.
All right. So if you've read and understood, considering it communication skills station, please begin.
Hello, sir. I'm Dr. Iqbal, working as SHO in John Hopkins Hospital, and my consultant name is Dr. Man. Sorry to bother you at this time. Actually, I'm calling to speak Dr. Adam to update him and seek him medical advice about a patient with road traffic accident. Can I confirm I'm speaking to Dr. Adam?
Yes, I am Dr. Adam. Can you summarize your case, please?
Thank you so much, sir, for your time. Uh, Actually, my patient, Mr. David, 20 years of age, presented in accident and emergency department after the motorbike road traffic accident. On examination, his GCS is 15 by 15. Even he has a loss of consciousness before arrival to the hospital. He is hemodynamically stable. Abdomen is soft and non-tender, but he has abrasion on the left upper abdomen. Along with that, there is a swollen right hand and open fracture of the left leg. Ultrasound shows there is a free fluid inside the abdomen, especially on the left parabolic gutter. And X-ray shows that there is a fracture of tibia and fibula. All the lab investigations are normal. Uh, and along with that, we have given in the emergency intravenous fluid, which is around 2 liter normal saline, antibiotics, and tetanus. At around 11:35 p.m., the nurse called me and we have examined his distal pulses of the left leg, like dorsalis pedis and posterior tibial artery, and there is no distal pulse in the left leg. And my main concern is patient is having acute limb ischemia. So it would be grateful if you provide some medical advice about further management of this patient.
Okay. What's the most urgent in this patient?
As the patient has open fracture, so I'm suspecting that there is a possibility of arterial disruption. So he need urgent intervention for uh, compartment syndrome, and there's a risk of loss of limb as well.
Okay. And what are the cause of pulseless foot?
It could be due to vascular injury. It could be due to compartment syndrome. It could be due to kink in the blood vessels, or maybe there is a possibility of the arterial spasm.
Okay. What is missed in investigation for this patient?
According to my point of view, I think as I'm suspecting that arterial injuries, so duplex ultrasound, and if the time would allow us, we can do CT angiogram. So I think these are the missed investigations.
CT angio for what?
CT angio for blood vessels to see the status of the vessels of the lower limb, as I cannot be able to palpate that, and his left lower limb is pulseless and pale.
Okay, only for the lower limb, the CT scan. You don't need to do head CT scan and pelvis and abdomen.
Other Yes, we need to find out because he has a transit loss of consciousness. So we need to do CT scan of the head. Along with that,
So
there is the intra-abdominal fluid. So we need to
okay,
do CT
so
scan of the abdomen and
yeah,
pelvis as well.
yeah. Is the patient is wearing a C collar?
Uh, so it was not mentioned in the notes. Definitely, I will check this for you.
Okay, please check it, and if it's not, please protect his cervical spine. Okay.
Okay.
If the patient came to you in the ER, how this patient should be managed?
So patient should be managed according to the ATLS protocol using the ABCD approach.
Okay. Thank you. What's the plan of action
Sorry.
for now?
Sorry.
For his pulseless leg, and if you want to take the patient to the operation, who will you inform this patient? Who will you consult?
Okay.
Other team.
I will inform first the operation theater. Along with that, I will inform the anesthesia registrar, and then I will inform general surgeon, plastic
Okay.
surgeon,
Okay.
and neurosurgeon, and along with I will also inform
Vascular.
my consultant as well, and cardiovascular surgeon and orthopedic surgeon.
Okay. And what you will do for this deformed leg?
So, as this is an open fracture, so I think we should apply external fixator for this deformity.
No. In the ER, what you will do for this deformity in his leg? If you find the leg is deformed
In the ER,
and
in the ER,
pulseless.
yes. In the ER, we can only reduce and immobilize the fracture.
Yes,
And after that, we
mobilize
will
it. Put a cast. Okay. What to do before sending him to the theater?
before sending him, we need to resuscitate the patient with IV fluids, and I
Yes.
will give some antibiotics to prevent the infection. Along with that, I
Yes.
will give some analgesia to stop the pain. I will do anti-tetanus immunization, and along
Okay.
with that, I will definitely cover the wound.
Okay. You will wash the wound in the ER?
No, I don't think so. I will not wash the wound in the ER because it will
Yeah,
increase the risk of
correct.
infection.
Yeah.
Yeah,
The
we
wash
just
should
cover
be
it.
in the OR. The wash should be in the OR. Okay. If you call the vascular and he is getting ready, and what you will do during this period?
Sorry, sir.
Uh,
Could you please repeat the
if,
question
if
for me?
if you call the vascular and he is ready to do the surgery, and he said to you, I am coming, what you will do while he is coming?
So what we can do is actually it is an open wound and dead and necrotic wound. So we can do the debridement of the necrotic tissue until the vascular surgeon will arrive.
Okay. What will you do for the wound during the operation?
I will do the debridement of the necrotic tissue because it will
Yeah.
increase the chance of the infection.
Yes. IV antibiotic and plastic surgery consultation. What you debride? Okay, and the debridement should be in the operation theater. What blood investigation you will send for this patient?
I would like to do full blood count, urea and electrolytes, liver function test, along with that blood group and cross matching. And I would also like to perform serum lactate levels and ABGs.
And renal function test. Okay. Why are you calling me?
Actually, I'm calling you. I want to update you about this patient that there is no pulse in his leg. So maybe as I'm suspecting that he is having acute limb ischemia. So maybe we need to do surgery overnight.
Yes. Will you fix the fracture and why? How you will fix the fracture and why?
For this open wound, I think we will fix the fracture with external fixation.
Yes. Why?
Because external fixation actually provides the stabilization of the soft tissue and bony disruption initially. So we call this damage control surgery. And after that, this external fixation also allow us to assess the soft tissue and the neurovascular bundle later on.
Okay. Why did
And
general surgery ask for ultrasound, and when they felt abdomen was normal? Why he asked for ultrasound?
yes, on examination it is normal, but as he is having the abrasion on the left side of the upper abdomen, so maybe we are suspecting that's a splenic hematoma. So that's why we need
Okay.
to do ultrasound to find out is there any intra-abdominal lesion.
Okay. Okay. Who you will call intra-op? What teams you will involve in this case during this operation? Again.
I would like to involve first of all anesthesia team along with that general surgeon, orthopedic surgeon, vascular surgeon, and
Mhm.
neurosurgeon
And
and
Okay.
plastic surgeon as well. Plastic
yes,
surgeon.
and
Yes.
OT, operation theater as well, people.
Why you will call
Yes.
the plastic surgery?
Uh, because of the open wound, there may be a need of to cover the wound, or maybe need to apply some graft on it.
Grafts, yes.
Okay. Why GS general
General.
surgeon? Why you will involve the general surgeon?
The involvement, I would like to involve general surgeon because uh, he has arterial disruption. So maybe there is a possibility of compartment syndrome. So I want to rule out the compartment syndrome by the general surgeon. And along with that, there is intra-abdominal fluid. So maybe there is a need of to rule out any intra-abdominal injury. And
Okay. What
yes,
the
yes,
management of the free fluid on the abdomen?
the management of this free fluid is exploratory laparotomy.
Yes.
Okay. Patient have metacarpal bone fracture. What you will do for this his metacarpal bone fracture?
For damage control surgery, we can only apply cast. But if you want to do a definitive surgery, then we need to apply some pins inside the shaft of the carpals.
Okay. If it's not open fracture, you can reduce it and put a splint. Then orthopedic consultation. Okay. What you will before this? What you will inform this patient about his hand fracture, as this patient is a medical student.
I will like to inform
About his hand fracture.
about the orthopedic consultant so that he would guide us better about the management of this patient.
Yes, he's medical. You will discuss him about the complication may happen, malunion, non-union, delayed union, and stiffness of the hand may occur, affecting his hand in his career. Okay, thank you. Thank you.
Thank
Thank you, sir.
you.
Thank you so much for your kind information.
Thank you.